everybody. Welcome back, and thanks for joining us for our final health interview session with Dr. Shannon Magari. Dr. Magari serves as Principal and Vice President of Health Services at Quill Corporation, as well as a visiting scientist at the Harvard T.H. Chan School of Public Health. So to cap off the series, today we'll discuss how Quill customers can stay safe and healthy during holiday travels. So, Dr. Magari, to kick things off, how do you feel about gathering around the holidays? And if people do decide to get together with families, are there any precautions that they can take to stay as safe as possible?
Ellie, it's a great question. I don't want to be the negative Nelly, but I'm honestly very scared for folks to get together for Thanksgiving. I can tell you personally, my family, we decided to do a Zoom Thanksgiving late in the day. I want to back up a little bit on your question is how to gather safely. I want people to really examine the question of whether they should get together at all. Okay. And I'm not trying to cancel Thanksgiving, but I want everyone to really evaluate whether they need to get together. I have a client who's this wonderful man. He's a Catholic priest. He's running a large institution. We were on a Zoom call in May. A little bit of confusion. There's 10 people on the line. Everyone was talking. We're trying to figure some complicated things out. And he just said, stop. He said, everybody stop. He said, Dr. Magari, what is the most loving thing we can do for our community right now? And it reframed the conversation, right? It wasn't about scientific things and infection rates and preventing transmission and all this other kind of stuff. It was just a different question. And I want to pose that all to you all and pass that on, which is getting together for Thanksgiving really the most loving thing you can do for each other and your loved ones, some of whom may be very vulnerable. So answer that question. Everybody's going to answer it differently. If you do have to travel, there's absolutely things that you can do safely. I'm in the Northeast. Gathering outside is absolutely preferred. Making sure that you understand the difference between outside and inside. I've seen some outside structures that look pretty comfy and cozy that kind of look like inside. But the CDC has a great set of gathering safely guidelines about minimizing the number of people that are gathering, trying to do and enact a proper quarantine for as long as possible before you gather, considering the way in which you travel to get there. Maybe this year you're going to drive a little longer than you normally would, because you would usually fly or take a train or whatever. So there's things that you can do to mitigate risk. But I'm just going to challenge everyone to really think about whether they need to get together to begin with.
Great. Yeah, actually, I hadn't thought of that framing until you mentioned it. Like, what is the most loving thing you can do for your family over Thanksgiving? I really like that. I'm going to build a little bit off of if employees do feel like they have to travel or that they choose not to cancel their Thanksgiving plans, should they be quarantining upon their return? And if so, for how long?
That's a great question, Allie. It's a complicated question. The regulations right now are so varied state to state. The best guidance there is for folks to check the regulations for the state that you're entering and the state that you're returning to long before you leave. Some states are requiring negative COVID tests on entry 3-4 days before. Some states that you're returning to, again, are requiring either a quarantine. I know New York State is a 14-day quarantine or a negative COVID test 4 days after you arrive back. So those regulations are complicated. The other issue is individual employers may have their own sets of regulations. I've been helping my clients develop some of these things just for these issues of people traveling over the holidays. And so individual employers may have different regulations. And I also just want to point out the concept that, so you might not be traveling somewhere for the holidays, but somebody may be coming to visit you, and that may be just the same, right? Maybe not as risky, but making sure that we're thinking about the interaction, not necessarily just the location.
I'm glad you brought that up because it totally didn't occur to me that my guests who come in from out of state that therefore I come into contact with, that just makes it so essentially I've traveled out of state as well. So I'm glad you
Right.
brought that up.
We got to be careful about both.
Yes. So thinking beyond COVID-19, how should employees handle just normal seasonal sickness like common colds this holiday season? And does COVID-19 change how we handle common colds?
Ellie, this is really important to address since a fair number of the symptoms of COVID-19 just flat out overlap with a lot of other respiratory illnesses, flu, common colds, and things. We really have got to take everything seriously now. We can't just, motor through like we're used to. A number of employers that I work with are requiring folks to go to the doctor. I would encourage folks to reach out to their healthcare providers if they've got symptoms that are consistent with COVID-19. We just can't be too careful right now. I've seen COVID-19 go from 0 to 60 like within hours, and so we can't be dismissive of what we might think is the common cold anymore.
Got it. And I'm going to dig a little bit deeper into, you mentioned the flu. So I know a lot of us have heard from our doctors that the flu vaccine is more important than ever during the COVID-19 pandemic than in past years. What do you think the importance of getting the flu vaccine this year is for us individually, as well as the safety of our colleagues with whom we work with?
Allison, we have got to get our flu shots this year. It's more important than ever that we harness every bit of power that we can to protect ourselves, protect our communities, and those who are most vulnerable. We need to keep as many people out of the healthcare system and particularly the hospitals as possible. The early signs from the southern hemisphere on what the flu season is going to look like, they're our usual leading indicator. Looks like it's going to be a milder than not flu season. It's probably because all the controls we're using to control the SARS-CoV-2 virus also control the flu transmission of the influenza virus, but we absolutely need to get our flu shots this year. Early on, we were talking about the potential for a twin-demic if folks weren't getting their flu shots. So yes, please go get your flu shot.
Great. Thank you for that PSA announcement. It's really important. So, last question to wrap up the whole series that I know a lot of folks are curious to hear your perspective on. So, based on your expertise in epidemiology and COVID-19, if you had a crystal ball, what do you think in terms of like when life will get back to normal?
Oh, what I wouldn't give for a crystal ball right now, Ellie. I'm going to take my cues and my answer from history. So if you look at the 1918 pandemic, that nominally lasted 22 months. So as an outward side of things, let's say this transmission started in December of last year. We're approaching the 11-month mark. That would set us on track for really being on guard most of next year. And so I think, the new normal is going to start appearing next summer when more and more people get vaccinated, hopefully, and we can return to some semblance of normal. And, in the fall, I think the anxiety and the stress from this pandemic is caused in part by not knowing when it will end, right? If you know when something bad is going to end, you'll know you're halfway or three-quarters of the way, and the anxiety is less. But I think it's going to be a long winter, and I think folks have got to just sort of steel themselves and come up with coping strategies and figure out new ways to connect and during the long winter months. But I think normal will start appearing late next year, probably fallish.
Yeah, thanks for sharing your projections, and I guess time will tell. Well, thanks once again for coming to Quill and sharing your expertise with us, Dr. Magari. We really appreciate your time. And I guess to wrap up, if any of our customers are interested in reading more about all of the topics you've shared with us, is there a specific place that you'd point them to do further reading?
Yeah, we've really got to stick with vetted sources. There's just so much information going on here. I think the CDC website, cdc.gov, and the World Health Organization website, truly great vetted sources. I think if you want to look a little locally about what's going on, look to your local Department of Health or your state Department of Health. Stick to those sources for recommendations and advice.
Great. Thanks once again.
Thank you.